The blocks in red indicate where stage 4 has been reached, the most critical level. Osaka's medical system is on the verge of collapse.
This is the Japan COVID update part 2. In today's video, I will talk about the ongoing COVID crisis in Osaka due to the spread of the COVID variant and the lack of hospital beds. There are presently 18,000 people in Osaka waiting for hospital beds to open up. Many will die before they have any chance of being hospitalized. Many care home residents who have contracted COVID-19 are passing away due to the lack of being admitted to any hospital. Throughout Japan, the vaccine rollout, although starting to gain momentum, is still in its infancy, with less than 1% of seniors over 65 years old vaccinated after 1 month. With the Olympics just over the horizon in 2.5 months, there's a lot going on here with Japan Coronavirus 2021. So let's rock and roll. Hi, I'm Mike Matsuno, the man in Japan. On this channel, I share videos about what's going on in Japan. If you like watching the video, please hit that like button and subscribe if you want to know when my next video is coming out. In Osaka, the COVID crisis continues. There are not enough hospital beds for critically ill COVID cases. Until this past week, Osaka University Hospital even gave up its 30 ICU beds for 10 days to take in the overflow of critically ill COVID patients. But to me, only 30 beds seems such a small number when the last news report I saw said that 18,000 people are waiting for hospital beds to open up. And just 10 days seemed like just a drop in the bucket when comparing to the ongoing crisis. I remember watching the news about the US last year when doctors, nurses, and hospitals were having to make the painful decision of who to save or who to admit and who to let go. This is similar now of what's going on in Osaka. The director of the hospital at Osaka University Hospital tried to explain this on the news.
Footage of the ICU at Osaka University Hospital. Based on a request from the prefecture, the hospital committed all 30 of its ICU beds to coronavirus patients over a 10-day period ending yesterday. As of yesterday, the number of seriously ill coronavirus patients in Osaka Prefecture was more than 400, exceeding the number of hospital beds for the very sick. Still, Doki says it's unrealistic to use all of the ICU beds for coronavirus patients. He says if they use most of their medical services for coronavirus patients like they did over the past 10 days, there will be many other people who can't get treatment.
As you can understand, whenever you redirect ICU beds for critically ill COVID patients, other people with other illnesses and injuries will also be negatively affected, and their health and quality of life could be at risk. Major surgery regarding transplants that could save and prolong other people's lives, but redirecting hospital beds could affect patients not getting the transplant or being delayed.
The university is capable of conducting organ transplant surgeries, but a doctor who heads the intensive care unit says such surgeries are virtually impossible if beds in the ICU are not available. Recipients of organ transplants involving brain-dead donors are chosen from patients registered at hospitals nationwide according to their diseases, blood types, and other conditions. But those registered at the Osaka University Hospital will likely lose their chance even if a donor that meets their needs appears, as long as the ICU is unavailable to them. The doctor says providing intensive care is indispensable after patients receive organ transplants. He says most medical treatments offered at his hospital cannot be performed at other medical institutions. He says the situation should not be allowed to continue for a long time.
Like in all areas of the world, care homes are the most vulnerable. Many of the 18,000 people waiting for hospital beds are senior citizens, many who are in care homes. Care homes are not equipped to care for critically ill COVID patients. In Osaka, many patients and staff have contracted COVID, but those who become critically ill, there is no hospital that can admit them at this time.
An organization of nursing care facilities in Osaka Prefecture says that 40 clusters of infection have occurred at their facilities in the past month. In one of those cases, a large number of residents were infected at a facility in northern Osaka. None of them could be hospitalized. 2 of them have died. The head of the organization, Kawai Shuji, says that nursing home staff do not know how to treat COVID patients. He says it is extremely frustrating for them to watch residents die because they have been denied proper medical care. Due to the severe shortage of hospital beds, more than 10,000 COVID patients in Osaka are now being kept waiting at home until hospital beds can be found for them. Over the past 2 months, 12 patients have died at home while waiting to be hospitalized.
One thing that I do not understand, if Japan had been closely watching what was happening in the US and Europe the last year, why didn't the Japanese government better prepare with more hospital beds, medical support and facilities, and practical planning? When the US was going through that terrible time of thousands of Americans who were dying daily, medical hospitals were being overwhelmed, frontline medical workers were bearing the brunt and pain of overwhelming odds, and there were not enough nurses, doctors, and medical staff. Japan still had enough time at that point and could have prepared for this worst case scenario. Instead, all I heard on the Japanese NHK news was the same story repeated over and over again to avoid the 3 C's and make sure to do the social distancing. There were also the implementation of state of emergencies in Japan, but I rarely heard of any plan of vaccines or what the mangaichi plan would be. Mangaichi is the Japanese word meaning the 1,000,001 chance of an incident or event that would happen. And that's strange because Japan is usually very good about planning for that mangaichi. But again, as I mentioned in the last video, my personal opinion is that Japan is more of a reactive society. They are not proactive. They are usually very good when it comes to refining and improving systems that are already running. But when there is no precedent, that is where there is no proactive action. This is, I believe, Japan's Achilles heel. Japan tends to take action only after the fact and is reactive to a crisis after it hits, but not proactive enough to prevent or lessen the crisis. This is also the same when it comes to the COVID vaccination rollout. Japan started vaccinating medical health professionals back on February 12th. 4 months later, the latest report I heard was that only 23% had received their first shot. How can it be that slow? April 12th, the vaccination started for senior citizens 65 years and older. As of yesterday, 1 month later, they had only vaccinated about 330,000 seniors out of a total of 36 million, which is less than 1%. Back in November of last year, 2020, I first heard that frontline medical professionals would be vaccinated from February 12th, which at that time I thought, why not sooner? Then I heard that senior citizens 65 years and older would be vaccinated starting April 12th. And again I said, why are they waiting so long? And at that time, they said they would complete vaccinating the seniors over 65 by the end of June, which I thought again, why does it take so long? Well, last week, they said the completion of vaccinating the seniors 65 and older was going to be at the end of July, which I thought, oh well, it's another delay. But this past week, I found out that many local governments had been originally told that the middle of September was the goal to finish vaccinating for the seniors 65 and older. But suddenly, Prime Minister Suga changed it to a month and a half earlier to end by the end of July. So municipal and local governments are now scrambling to try and finish by the end of July, which the majority do believe that is possible. Although 1/3 of medical institutions in Tokyo say they will not be able to finish by the end of July. And that's another problem here in Japan. Information that comes out of the government is sometimes inconsistent, and there are actually quite a few changes. Government officials and communication channels are many times vague, sometimes evasive, and even indecisive. For many foreigners like myself, not understanding all the difficult technical Japanese and kanji puts us in the dark. My layman observation would be that usually Japan's decision-making style of consensus and a kind of nemawashi is an effective way of getting things done when you have a lot of time. But in a pandemic or a national disaster like the Great Tohoku earthquake and tsunami in March of 2011, Japan does very poorly. There's too much time wasted on meetings, consensus, trying to be fair and trying to get everyone to agree. There are just too many moving parts. Personally, I think what is needed is strong leadership, well-informed and quick decision-making, and transparency and accountability. Japan also does not have a CDC type of organization like the US does to handle infectious diseases and set health policy and procedures like with the coronavirus. In Japan, they have an advisory board of experts made up of doctors and medical professionals. But the advisory board does not set policy for the government. They are only advisors. And also, there is not one unified and decided message coming from the advisory board. Each doctor or advisory member shares their opinion, and they may come on news or sometimes on TV and they share their opinion, and they're not all the same. The advisory board members share their opinion, and the government then decides and sets the policy. But usually getting all the members of the advisory board and holding all of these meetings takes time, and in the end, the Japanese citizens are the ones that suffer. In fact, there are some doctors who have said on the news the same thing that I have been asking. One doctor just this past week said about using other medical professionals to administer the vaccination injections. He said, why not use pharmacists or others? So it is not only me asking those same questions. Another doctor said the other day that the same thing I was asking about. Why can't some of these 18,000 people who are waiting for beds in Osaka be taken to other prefectures or cities who have hospital bed space? So doctors and medical professionals are asking the same questions that I have been asking. So my only conclusion is that it has to be the government and the bureaucracy system that is too rigid, and no one ever thinks about changing the rules to adjust to the present crisis, or maybe it would take too long to change the rules, even if it involves saving people's lives. It seems mind-boggling to me. My metaphor for Japan to change the rules or the mindset of the people in charge is similar to trying to change the direction of a supertanker that's sailing. It takes a supertanker about 15 miles or 25 kilometers to stop. In other words, it takes a long time to get any change in Japanese society. The Japanese government ministries and the bureaucracy hold much of the power of government, and their job is to follow and uphold the rules. You add in the cultural norm of the standing nail gets pounded down, and you have a society of people who do not buck the system because they might be ostracized, they might not get promoted, or they might look like a troublemaker in Japanese society and within their organization or company. This is where the critical thinking, problem solving, and taking risk skills are so very much needed. Lastly, if you got any value from this video, please hit that like button, and if you're interested in future videos, please subscribe. The last thing I want to say is that I really hope that Japan will pull itself out of this 1 year of pandemic craziness. And I think really the young people have to go outside of Japan to learn different skills, whether it's assertiveness, leadership, critical thinking, problem solving, and then come back to Japan and help change and improve the systems that maybe at one time were very valuable and worked very well for Japan, but in today's global world actually hinder or hold them back. Anyway, thanks for listening. Hope to see you in the next video. Take care and catch you on the backside.